Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and Plex and OET training. And today, welcome back to Magic Pearl session. Today, the topic what we are going to discuss is simplified psychiatry. We are discussing the important point related to mental status examination. And if you like the video, please like it, share it, and subscribe the channel so that it will motivate us to post more and more videos. So in the last class, that is in part 1, we already started with the mental status examination. Those who doesn't watch the video, please watch that video first and then come back to this part 2 video. Already part 1 video is streaming in the YouTube channel. Okay, fine. So already we have discussed so many points in the part 1 videos. Just I'm giving a review of that. You can just see the slides. We already discussed about mood and affect with the example. Studying with the example in psychiatry is very important. We discussed about flat affect, labile affect, inappropriate affect, congruent affect, and also we discussed the MCQ point related to mental status examination thought process. Underline the word thought process. It is classified into 4 or categorized into 4, that is flow, content, form, and possession. We already completed content in part 1 video. Now in this video we are going to start with the flow and then we are going to move forward into form and possession. So watch the video till the end. It will be very useful for you. And also in content we discussed about questions and also different types of delusions like persecution, reference. So many delusion types so far previously asked in the exam. We have discussed that, and today we are going to start with flow. It is also called as stream. Flow and stream. See, what is this? It is a thought process, goal-oriented thought process. Okay. For example, if some physician or some person is asking you a question, what is your name? And what is your goal now? You have to answer the question. That is your goal. And you are saying, my name is Ramesh, my name is Kamalesh, my name is so and so. Okay. So once you replied properly, once you said your name, that time the goal is achieved. If someone is asking where you are coming from, I'm coming from Delhi, I'm coming from Puducherry, I'm coming from Chennai. So what someone is asking question and you are replying for that particular question, that is called as what? Goal is achieved. Your thought process is completed. So this is called as what? Flow of thought. Suppose if it is altered, then at that time it is called as abnormal thought process. There are so many abnormal thought process. We are going to discuss one by one in detail. Okay, let's start with a simplified example. As I mentioned already, study psychiatry with the example so that it will be easy for you to understand. And also different terminologies will be there in the psychiatry. Understand the terminologies and memorize it also. So this example what I'm going to give here is, here you are asking to a patient, what is your name? What is your name? And the patient says, I am John. And he continue. Along with the answer, he continues with some other rhyming words also, like, I am a corn, my friend is Sean, and I know lawn. Okay, you can see here. If you are asking a question, what is your name? The patient says, I am John, I am a corn, my friend is Sean. Like that, he is continuing something. Okay, this is the abnormal thought process, right? Fine. So this kind of abnormal thought process, especially if the rhyming words are present, John, corn, Sean, lawn. Okay, so this type of rhyming words, if it is present, means that is called as what? Clang association. What is that? Clang association. It is a rhyming word. Okay, meaningless rhyming word. Okay, one more example you can see here. This is the example of flight of ideas. Here, from a manic patient who was asked where she lived and she replied. The question was, where you are living? And she is replying different, not at all existing words like, Brigham, king standing, sees the king, he standing, king, king, sing, sing, bird on the wing, 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 bird, bird, tongue, tongue. This is called as what? See, clang association. So the question is different and the answer what the patient is expressing is totally different. Okay, so especially the rhyming words are present means that is called as what? Clang association. Always keep in mind, if the clang association is present means the speed of response from the patient will be fast, because it is a rhyming word. So the speed of response will be very, very fast. Okay, and one more thing is there, the patient, the physician, the psychiatrist is asking a question and the topic is diverted and they have not at all reached the goal. Not at all reached the goal means the patient never given the answer for the question what the therapist asked. Okay, so that is called as what? Tangentiality. So tangentiality, clang association, everything will be present in the flight of ideas. What is that? Flight of ideas. Okay, guys, see what is flight of ideas? It is a thought disorder that causes people to speak very rapidly, very fastly. Okay, and shifting between the loosely connected ideas. Okay, see here you can see in this example very clearly the therapist is asking where she lived and she replied Birmingham. Okay, and suddenly there is a jumping of the topic from one topic to another. She is talking suddenly about a king, and suddenly she is talking about a bird. Suddenly she is talking about a wing. Okay, so jumping of the ideas are there. Okay, so tangentiality means the person or the patient never come back to the goal what is the question is meant for. The physician asked one question and the answer is not at all given by the patient. That is called as what? Tangentiality, just opposite to circumstantiality. They will be discussing that also. Okay, so in flight of ideas, clang association, tangentiality will be present. The best example I have given here. Okay, the next one, circumstantiality. Just opposite to tangentiality. See, tangentiality, actually speaking, it is a part of derailment. Okay, it is a part of what? Derailment. The physician or the psychiatrist, they are asking questions. Suddenly, there will be a deviation of the topic from the patient side. That is called as what? Derailment. Tangentiality is a part of derailment. Please keep that in mind. Okay, fine. So circumstantiality, what is the difference between the tangentiality and circumstantiality? Tangentiality means they will never give the answer for the question what the psychiatrist is asked. Okay, so their topic will be diverted and they will be speaking something else. Some other unrelated topic they will be speaking. And clang association will be there. They will be speaking something rhyming words also. Okay, but in circumstantiality, if the physician is asking where you are coming from, they will be talking different topics, but at the last they will give the answer. At the last, underline the word, at the last they will be giving the answer. That is called as what? Circumstantiality. You can see very clearly when asked about the age of the person's mother at death, during death, what is the age of the person mother? This is the question asked by the psychiatrist. And the speaker, that is the patient, replied that the patient is talking about some accident. The patient is talking about the death of some other persons. At last, giving the answer for the question asked by the psychiatrist. At last, giving the answer. Goal is reached at the last. In tangentiality, the goal is not at all reached. Okay, this is the basic difference between the tangentiality and circumstantiality. And one more thing is there, that is thought blocking. What is that? Thought blocking. It is also commonly seen as a psychiatric illness, most commonly seen in the schizophrenic patient. Here, a person's speech is suddenly interrupted or stopped. See, continuously, if the therapist is asking some question, means the patient is giving the answer. Suddenly, the answer or the conversation from the patient side is stopped. Okay, and a silence is maintained. The conversation stopped, silence is maintained for a few seconds or few minutes. After that, again, the patient start to talk in a different topics. With a different topic. Okay, so this is called as what? Thought blocking. Okay, guys, these are all the different types of, abnormal thought process. Okay, guys, the next abnormal thought process what we are going to discuss is perseveration. What is that? Perseveration. Okay, so the best example or best meaning of the perseveration is patient stuck on the same thought. You can see here, patient stuck on the same thought. Okay. Best example I will be giving now. A psychiatrist asks the patient. The psychiatrist asks the patient, what is your name? And the patient replies, Mukesh. The second question from the psychiatrist, what do you do? Again, the patient replies, Mukesh. Where do you live? The patient replies, Mukesh. What is your wife's name? Patient replies, Mukesh. The answer is same for all the questions. The patient stuck in the same thought. In the first question, the patient stuck in the first question and giving the same answer for all the questions asked by the psychiatrist. So that's why in the meaning, I have clearly mentioned the patient stuck on the same thought. commonly seen in the organic mental disorder and schizophrenic patient. Okay, guys. Yes. The next what we are going to discuss is form. See, in the part 1, I have completed thought process of content. The first category, content, is over. And in this part 2, we discussed about the flow of thought. Flow, it is also called a stream. That is what we have discussed so far. And now the another category what we are going to start with is form, F-O-R-M, form of thoughts. Content of thought is over, flow of thought is over. Now form of thought. Form of thought is also called a structure. Structure of the sentence, structure of the statement given by the patient. Okay, so we are going to assess the structure of the statement or answer given by the patient. We are going to assess that. Okay, that is called as what? Form of thought. Okay, guys. So here the best example, the first example is derailment. See, as I mentioned already, derailment. Tangentiality is a part of derailment. The definition is going to be almost same only. Okay, in derailment also, the patient is going to deviate from the topic. The ideas often fall further and further from the topic of conversation. Means the patient is diverted from the conversation what the psychiatrist is asking. The psychiatrist, for example, you can see here, a person with a derailment thought disorder might jump from talking about a rabbit. He is talking about a rabbit, suddenly he is talking about a hair, suddenly he is talking about the head, suddenly he is talking about a sweater. Jumping of the topics, jumping of ideas. The topic is diverted, same like tangentiality. This is called as what? Derailment. The next example of form thought process is neologism. Very simple. This question has so many times in the exam. Neologism, the division of neo and logism is new and word. Neo means new and logism means word. Okay, here the patient used to form a new words which is not at all existing in this world, which is not at all existing in the dictionary. For example, smoke and fog together they mix and they used to say smog. Smog word is not at all existing. Breakfast and lunch together they used to say it as what? Brunch. Spoon and fork together they used to say it as pork. Okay, these words are not at all existing, but still the patient is using it. This is called as what? Neologism, forming new words. Okay, fine. The next is tangentiality, already we discussed. Loosening of association. What is that? Loosening of association. See, all these things, derailment, neologism, tangentiality, loosening of association, everything is coming under what? Form thought process. Form thought process. Okay, so tangentiality already we discussed. Loosening of association means there is no logical connection. For example, if you are a therapist or a physiotherapist, psychiatrist, they are asking a question. What did you eat today morning in the breakfast? This is the question. Okay, see what is happening in the loosening of association. The patient replies that, come back, order cab, eat food, go for the restaurant. Is there any relationship? No relationship. Loosening of association. But eating food, that word is present, but the exact answer is given, not given by the patient. Loosening of association. The thoughts, ideas are loosened. Okay, loosened. Fine, clear guys. This is called as what? Loosening of association. Once again, I will repeat, the ideas are not at all connected with each other. Okay, so question is what you ate in the morning, but here obviously they are talking about eating, but come back, order cab, go to the restaurant, eat food. It's losing of association. It's not properly connected with each other. Okay, so these are all things coming under what? Form thought process. In the last one is possession thought process. We are going to discuss now. This is the fourth category, possession thought process. Content over in the part 1, and now today in the first topic what we discussed, flow or stream, and second we discussed about what is that? Form, right? And the next one what we are going to discuss now is possession. See, possession, it is broadly classified into two types, that is obsession and thought alienation. Obsession and thought alienation, these two are the examples of possession. Okay guys, this is the last category in the thought process, possession. The best examples of possession is, the first one is obsession and second one is thought alienation. First, let's discuss about the obsession. Obsession, the best example is OCD, obsessive compulsive disorder. Obsession means imagination or the thoughts or the impulses or urge which is starting from the brain. Okay, so abnormal thoughts which is keep on coming and coming in the brain, or the urge which is keep on stimulating the brain, that is called as what? Obsession. OCD, obsessive compulsive disorder. Okay, so repetitive thoughts will be there for the patient. Repetitive same thoughts. Let's see with the example. Here you can see before eating, the patient wants to wash the hand because hand is dirty. So he wants to wash the hand. Okay, so that is the thought coming to the patient mind. Before eating, I want to wash the hand. My hand is dirty. That is the obsession thought. So immediately he is becoming anxious. I want to wash the hand, otherwise I will get infection. That is anxious stage. So immediately the patient is going and washing the hand. Okay, and immediately the patient is getting a temporary relief. Again, the same thought process is coming back. Again, after washing the hand, the patient is looking at the hand. Again, he feels like dirty. Again, he is getting anxious and doing hand washing, and he is getting temporary relief. Again, seeing the hand. Again, he is feeling dirty. Again, doing hand washing, and this cycle continues again and again. This is called as what? Obsessive compulsive disorder. Repetitive thoughts because of anxiety. Okay, yes. So this is the best examples of obsession, and the second one is thought alienation. Thought alienation. This is the second type of possession. Here, the patient used to think that some other person is controlling my thoughts. Some other person is controlling my thoughts. It is categorized broadly into three types, that is thought insertion, thought withdrawal, thought broadcast. Thought insertion means someone is inserting their own thoughts into my mind. Someone is inserting others' thought into my mind. Okay, so that is called as what? Thought insertion. Someone is controlling my mind and inserting the other's thought. Okay, that is thought insertion. The next one is thought withdrawal. Someone is withdrawing my thoughts. Someone is taking away my thoughts. Okay, the last one is thought broadcast. Someone is broadcasting my thoughts. Someone is displaying my thoughts to others. Okay, broadcasting my thoughts. So these are all the key points you're supposed to remember, guys. Okay, so these are all the two things which is coming under what? Possession. So far we discussed about what are all the things. We have mainly discussed about the basic, that is mood and affect, and also we discussed about mental status examination, vital MCQ point, especially the thought process MCQ point. The thought process, it is categorized into 4 points. That is, the first one is flow or stream, second one is content. The content part we have discussed already in part 1, and the next one is flow or stream, form or structure, and possession. All these 3 topics we have discussed in today's session. If you have any doubts, you can drop your message in the comment section. Okay, and if you like the video, please like it, share it, and subscribe the channel so that it will be useful for us or motivate us to post more and more videos. And thank you very much for watching the video, guys.